Welcome back to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about the Maryland Cancer Fund, which is in great need for additional donations, and we'll tell you more about how the Maryland Cancer Fund has benefited folks in Frederick and why we'd like to see the Maryland Cancer Fund donations increase. And our special guest is Roseanne Russo, a nurse with the Frederick County Health Department. Roseanne, welcome. Thank you for joining us.
Thank you, Dr. Brookmeyer.
So I guess first we should start off with what is the Maryland Cancer Fund?
Well, it's a program administered by the Maryland Department of Health and Mental Hygiene, and it provides cancer treatment and diagnosis for patients who do not have any insurance. It also covers funding for some programs around the state as far as preventative and screening programs.
Mm-hmm. So can you talk a little bit more in detail about those services that the Maryland Cancer Fund covers?
Yes, the fund covers patients who are uninsured, who need diagnostic studies or treatment. So it gives a grant for 1 year, and it also covers some programs that provide colorectal cancer screening and prostate cancer screening, and also some quit tobacco programs as well.
Mm-hmm. So what are the eligibility criteria for the Maryland Cancer Fund?
First of all, the patient cannot be insured, needs to be a resident of Maryland, and also have a limited income.
Mm-hmm. How do people apply then?
They can easily apply through the health departments, through their local health department, or call the Maryland Cancer Fund coordinator in Baltimore.
Mm-hmm. And we should probably talk a little bit about why the Maryland Cancer Fund is important and needed.
Sure. Actually, cancer is the second leading cause of death in Maryland. And the illnesses can be very devastating, especially if it's not detected early. Certainly can lead to death in many cases. So the earlier the disease is detected, the better the outcome.
So in Frederick, how have folks from Frederick directly benefited from the Maryland Cancer Fund and the donations that people have made to the Maryland Cancer Fund?
Well, it's had a huge impact on individuals and their families, individuals diagnosed with cancer, because it has provided funds for both diagnostic studies and treatment, and that could amount to thousands and thousands of dollars. So, and not only has it benefited the patients that I've worked with, but also it's benefited everyone in a sense, because you know, some care would have been uncompensated, and that usually drives up health care costs for everyone. And I think it really has saved folks' lives. I'm convinced of that, for sure.
Right. Okay. And then I guess maybe the most important thing to end with is to talk about how people who would like to make a donation, how easy it is for them to do that. Mm-hmm. And also if you could mention the current status of the availability of funds in the Maryland Cancer Fund.
Yes. The donations this past year have been less than adequate to cover everyone that's needed the fund. So it's been closed this month in December. The fund has been closed, so we will not be able to access the fund for new patients until July 1st. So we'll have to try to find other resources, but that's very limited. In order to And all the services that are derived from the Maryland Cancer Fund come solely from donations, from taxpayer donations. And one way to do that would be to send a check directly to the Comptroller of Maryland. The easiest way to do it is to check line 37 on the state income tax form, and you could choose to donate any amount that you wish. That's usually the easiest way for most people to do it, is line 37 on the Maryland tax form.
Mm-hmm. Okay. Yeah, so I think I'd like to underscore that. So no taxes go to support the Maryland Cancer Fund. Just donations from people who are taxpayers or people who aren't taxpayers, I guess. Anyone can donate, and that there are no taxes that are used to pay for the Maryland Cancer Fund. It truly is just donations.
It's a direct donation, and all of the money that's donated goes directly to services, to treatment and diagnostic and screening services.
Great. Well, thank you so much for telling us about the Maryland Cancer Fund, and I hope that you will have inspired people to be interested in checking it out more, and hopefully also making some donations to keep helping Frederick residents.
We certainly hope so. Thank you.
Thank you. And now please stay tuned for this month's Medical Myth.
Looking to get fit this winter? Sign up for some of our fitness classes that will fit you best. Our classes range from Adult Active Yoga, Mighty Fit Yoga, Cardio Sculpting Party, Power Yoga, Mighty Fit Pilates, Charqui and Total Body Fit, Yoga Mind, Body and Spirit, Sula's Hoop Body Sculpt Class, or Walking Fitness Club. For more information, go to recreator.com.
For weather updates, citizens are encouraged to listen to local radio or TV. Call the Frederick County Government Public Information Line at 301-600-3000 or tune in to Frederick County Government TV Cable Channel 19. Notices are also posted on the Frederick County Government website at www.frederickcountymd.gov and our social media pages.
And now here's this month's Medical Myths. This month, I'll talk about myths related to New Year's resolutions. A common myth related to New Year's resolutions is that they don't work. Well, that is partly true. For all resolutions, if you are committed to taking action and develop a reasonable plan with realistic goals, then you will be more likely to be successful. For example, a common resolution is to exercise more. That is a great goal. But getting started may be overwhelming for someone who has an image of a spandex-wearing, muscled person spending hours each night at a gym. So setting realistic goals is the key. You may eventually get to that image you have, but to be successful, you may need to start out with a smaller and more attainable goal, like 5 minutes of fast walking at lunch or 5 minutes of going up and down stairs at work. You won't even need to put on spandex, and it won't take too much of your time from your already busy schedule. You can do it. It is within reach if you are committed and make a realistic plan. A second common myth heard around New Year's is a belief that going on a crash diet will be the best way to get to a target weight. It's natural for anyone trying to lose weight to want to lose it very quickly, but evidence shows that people who lose weight gradually and steadily, that's about 1 to 2 pounds per week, are more successful at keeping weight off. Healthy weight loss isn't just a diet or a program. It's about an ongoing lifestyle that includes long-term changes in daily eating and exercise habits. To lose weight, you must use up more calories than you take in. Since 1 pound equals 3,500 calories, you need to reduce your caloric intake by about 500 to 1,000 calories a day to lose about 1 to 2 pounds per week. Once you've achieved a healthy weight by relying on healthy eating and physical activity most days of the week, and that's about 60 to 90 minutes of moderate intensity, you are more likely to be successful at keeping the weight off over the long term. Losing weight takes more than desire. It takes a commitment and a well-thought-out plan. Here's a step-by-step guide to getting started. Step 1, make a commitment. Step 2, take stock of where you are. Step 3, set realistic goals. Step 4, identify resources for information and support. And Step 5, continually check in with yourself to monitor your progress. Well, one of the most common myths spread by smokers is that they can't quit. The truth is that many ex-smokers used to believe the same thing. And then they tried and tried and tried until they were eventually able to be smoke-free for longer than they had been smoking. In fact, since 2002, there are more ex-smokers than there are current smokers. You can be one too. Oh, and for those of you who say, I tried to quit before, but I just went back to smoking, you are actually in a really good position to be successful in the future. The experience that you had works in your favor for stopping smoking. You can make your 2013 smoke-free and tobacco-free. There are free classes in Frederick with free nicotine replacement therapy. There is a free 1-800-QUIT-NOW phone resource and support system. And now there is also a text messaging support system to help you be successful in following through with your resolution to be tobacco-free in the year 2013. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Behavioral Health Services Division. As winter approaches, some people begin to feel sluggish and gloomy. Less sunlight and shorter days means less time for outdoor social activities. Some people suffer from symptoms of depression during winter months, with symptoms subsiding during the spring and summer months. These symptoms may be a sign of seasonal affective disorder, or SAD for short. SAD is a mood disorder associated with depression and related to seasonal variations of sunlight. It affects 500,000 people every winter between September and April, peaking in December, January, and February. According to Harvard Medical School, winter depression accounts for about 10% of cases of major depression. 3 out of 4 SAD sufferers are women. The main age of onset is between 18 and 30 years of age. SAD is characterized by the onset of depression during winter months, when there is less natural sunlight. The depression generally lifts during spring and summer. SAD may be effectively treated with light therapy, but nearly half of those with the disorder do not get better with light therapy alone. Medication and psychotherapy can reduce symptoms, either alone or in combination with light therapy. SAD is different from major depressive disorder. Major depression is characterized by a combination of symptoms that interfere with a person's ability to work, sleep, study, eat, and enjoy one's pleasurable activities. Major depression can be disabling and prevents a person from functioning normally. Depression is a common but serious illness. Most who experience depression need treatment to get better. If you feel you may have depression or SAD, call your doctor to discuss your symptoms. Do not wait too long to get evaluated or treated. There is research showing the longer one waits, the greater the impairment can be down the road. So see a professional as soon as possible. Other actions you can take include be active and exercise, set realistic goals for yourself, break up large tasks into small ones, and spend time with other people and confide in a trusted friend or relative. Try not to isolate yourself and let others help you. Expect your mood to improve gradually, not immediately. Don't expect to suddenly snap out of your depression. Often during treatment for depression, sleep and appetite will begin to improve before your depressed mood lifts. Remember that positive thinking will replace negative thoughts as your depression responds to treatment. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.